Our next presenter comes from the Department of Kinesiology. Please welcome Jessica Holst-Wolf.
Now, if I were to ask you to close your eyes and touch your finger to your nose, you could probably do this pretty easily. Even little kids can do this. So my question is, how? How do you know to get your hand to your nose when you can't see it? Well, I can feel it, you might say, and that's it. You can feel where your hands and your arms are in space. You can feel how they're moving. And this is what I study. This sense of limb and body position and motion is called proprioception. And there are sensory receptors in our muscles that send information to our brain about muscle stretch. And from this, we perceive limb position and limb motion. Now, this sensory information is essential for accurate voluntary movement. If you drive your car without always looking at the shifter or the pedals, or even walk around without staring at your feet, you're relying on proprioception. And this sensory information is so innate to us that you may have never even considered the necessity of it unless you experience the loss or degradation of proprioception that can happen with various neuromotor disorders. So we understand the importance of proprioception. We also know that compared to other senses, proprioception develops relatively late, throughout childhood. But what we don't have is a comprehensive, clinically useful characterization of the development of proprioception in healthy children. Without this, it makes it difficult to quantify or even identify sensory deficits in pediatric patient populations. Populations that could potentially benefit socially or academically if they were identified. We could provide maybe they could benefit from therapy or intervention. So we set out to create this data set using a recently developed limb position matching paradigm. It's easy enough for kids to understand, and it gives us quantitative, objective information about proprioception. How it works is we have our participants wear vision-occluding glasses so they can't see where their arms are, they have to feel them. And then we have them rest their arms on the levers of our equipment. We move one arm and we ask them to match that position with the other arm so it feels like they're in the same place. We then can measure the error, the difference between the two limbs. We can do this multiple times with each individual, and then we've collected data from over 300 people, ages 5 all the way up through adults. And what we learned is the development of proprioception is an improvement in precision. And we actually looked at precision by its inverse or opposite, which is variability. So standard deviation is a statistical estimate of variability. And we calculated the standard deviation of that limb position matching error for each individual. And what we found is this measure of sensory variability decreases with age, hence an improvement in precision. We even calculated percentiles, so we have an idea of how an individual compares with their age-matched peers. So in summary, we created the first comprehensive data set on the development of proprioception. And next, what we plan to do is to use this method and this data set to see if we can identify sensory deficits in pediatric patient populations.